Happy to be here in Mozambique again. It's always a pleasure for me to visit. And in particular, it's a pleasure for me to share with you the results of this project. This is one of the first times that we're presenting this in public, and so I'm very pleased that we get to present it here in Mozambique to folks who perhaps have the strongest interest and background in these particular results. But we're also hoping that these can generate insights that are useful worldwide, because I think some of these issues are very prevalent in many developing countries, not just in sub-Saharan Africa, but elsewhere. So this work is joined with my co-author at UC Davis, Michael Carter, as well as a former student of Michael's who's now at the Universidad de los Andes, Rashid Lajaj. And I want to mention at the outset, we're very grateful for funding from USAID for this project. This wouldn't have been possible without funding from USAID. And I'll also mention at length how we very deeply collaborated with Banco Oportunidad on this project. Catherine Larco is here, and collaborated with her and with many other staff at Banco Oportunidad to make this project possible. As a motivation, I actually want to talk about a completely different type of development effort, which has been very high profile around the world, the Millennium Villages Project. Some of you are probably familiar with the Millennium Village Project because there are a few here in Mozambique as well. The basic idea behind the Millennium Villages Project this is basically just a screenshot from the web page of the Millennium Villages Project, and their basic theoretical idea is that no single intervention is enough to affect lasting change in any one sphere. We must improve them all. So this is the fundamental theoretical conceptual idea behind it. And so you'll see here that they have, you just see these boxes over here, they have the different types of areas where they conduct interventions to reduce poverty in these villages, interventions in the area of food, water and energy, environment, technology and innovation, education, gender equality, mother and child health, business and entrepreneurship. I mean, just basically a very, very broad set of interventions that are sort of thought to combine in a very positive way to improve poverty. But they're actually making a fairly strong claim that the concept here is that you can't actually improve any one area on its own. You need to improve on a number of fronts simultaneously because they all support one another. Said differently, there might be sort of key barriers to improvement that you have to overcome in order to make improvements on any front. So, for example, you might think of the synergies between education and health, for example. You might think that it might be very hard to get students to come to school and to really retain what they're learning if they have serious debilitating diseases, or if they have worm infestations, for example, that reduce their ability to concentrate in school or even attend school. So really, you can't imagine. The idea is that behind the Millennium Villages is that you can't improve people's education if you don't improve their health as well. The health creates a barrier to education. So this is just sort of one example of the many possible synergies or complementarities that the Millennium Villages are imagining across interventions. It's a compelling idea, it's a very exciting idea, but it's also quite untested in development research. And so what we're trying to do with this project is to remedy that by looking at the intersection, the complementarities between two particularly important types of interventions that we conducted in Maninga province. Again, the broad conceptual point here is that there are many anti-poverty programs in developing countries, certainly quite a large number in Mozambique as well, that are bundled in that they consist of multiple components that are acting simultaneously. So the Millennium Villages are an obvious example, but there's also a wide variety of very high-profile programs in developing countries. For example, programs to help the ultra-poor. Dean Carlin, who will be speaking later, came out with a very, very exciting study recently showing of the impacts, the positive impacts on the ultra-poor of a program that provides a wide variety of services and interventions to poor populations. So some components include transfers of resources. So in this, the ultra-poor programs, they transfer assets, goats, cattle, things of that sort to the poor. Skills training, savings, health interventions. So basically a very broad set of interventions that are simultaneously being targeted to help the poor. So this is just another prominent example, and Dean Carlin perhaps will be talking about some of this work later. But it's actually quite, one open question about these programs is, how do the different components of these programs interact with one another? Are they in fact all necessary? Do the different components of the programs complement one another, or are some of them actually substitutes for one another? Do you really need to implement all of the different pieces simultaneously to get the positive development effect? And this is important not just conceptually, because not just because we want to know this for science and social science, but it's also important for practical purposes because these bundled programs tend to be very expensive. The Millennium Villages, you can imagine they're incredible amounts of resources that are spent on delivering all of these combined programs simultaneously to help the poor. And these ultra-poor programs that I just mentioned as well are also extremely expensive. They cost at least several hundred, if not a few $1,000s per beneficiary, per person who receives these benefits. So they're extremely expensive programs, and so it'd be very important to understand when you have a program that bundles all these different interventions together, which ones are more effective than others. Can you drop some of the components and still get the development benefit? Or do you really do the components really combine in a positive way so that you get more impact when you offer them together than when you offer them separately? So these are open questions. What we're doing in Manica, what we did in Manica is to look at the interplay between two important types of programs. So we didn't offer the same wide variety of programs that the ultra-poor programs or the Millennium Villages programs did, but what we did was we looked at two important pieces of these that are typically in these programs. The first is agricultural input subsidies, and the second is formal savings. Interventions try to get people to save in formal institutions. So that's what our research is about. And so in this way, sort of contributing, to start contributing to our understanding of how bundled programs, what is the interplay between interventions and bundled programs. All right. So let me talk about each one of these types of programs in turn. So first of all, input subsidies. So this is just an image of one farmer outside of Chimoio who is using modern fertilizer to improve seeds, and this is a part of an intervention of IFPC that sort of is advertising. As you can see in the sign, what kind of what this individual is using on his farm. So input subsidy programs are probably the most significant recent development in agricultural policy in sub-Saharan Africa. So this involves on a large scale subsidizing modern inputs like fertilizer and improved seeds. Across 10 countries that are implementing ISPs, expenditures in 2011 were about $1 billion US, and that comprised about 29% of public agricultural spending in those countries. So just a huge expenditure of resources. This is a very, very large type of government program. These are often supported by very large budgetary support from donors like the World Bank and national bilateral development agencies. And this is the fact that the World Bank and other development agencies are supporting these programs is a real conceptual turnaround. In previous decades, the international development community was very against the subsidies, but now, at least in the context of agricultural inputs like fertilizer and improved seeds, there's been a lot more support for these types of programs. Here's just a sense of ISP expenditures as a share of the government agricultural budget in the 10 countries in sub-Saharan Africa that have implemented these programs. So, like I said, on average, they account for about 29% of public agricultural spending, but there's a great deal of variety. From on the one end, Burkina Faso and Ethiopia spend 8 or 10% of their government agricultural budgets on input subsidies. On the other hand, Tanzania and Malawi are spending 46 to 58% of their agricultural budgets, government agricultural budgets on these ISPs. So they're very, very large programs for the countries that are using them, that are implementing them, and it's really important for us to understand how what their development impacts are and how we can might be able to do better, in fact, than just providing these subsidies, simply providing these subsidies. The other type of intervention that we're interested in is a savings intervention. So on the bottom left of the screen here, we have an image of Banco Oportunidad's branch in Vila de Manica that I took when I was there a few years ago working on this project. So there's been a great deal of interest in savings interventions in developing countries, and these are broadly involve getting poor people access to formal savings facilities and formal institutions to complement whatever informal savings that they're doing. And also there have been a number of attempts to provide savings match programs, mostly in developing countries. In developed countries, in the rich world. In the US, they're known as individual development accounts. Basically, these tend to be relatively expensive, but basically they try to give people they're match programs in the sense that you might provide a one-to-one match, for example, for every dollar saved, the donor will provide an additional dollar. And in the US, they can use to help promote homeownership, to get people to save up for the down payment on a house or a piece of land. So I mentioned that because that's partly what we do here as well. There have been a number of experimental studies of savings interventions across many developing countries, but they have not so far, until today, examined their interaction with other programs. In particular, looked at how they interact with a fertilizer or agricultural subsidy program, like we're doing here. Okay, so just a couple of conceptual points here. We're interested in the complementarity between a subsidy program on the one hand and a savings program on the other. And so, this is the most map that I'll be showing in this presentation, but basically I just want you to think about two interventions or programs that have impacts on, say, household consumption. So we'll be thinking about, when we're thinking about complementarities, we'll be thinking about how much are these programs raising household consumption levels. That's going to be our measure of how households are benefiting from these programs. And so we think about the impact of one program, say the subsidy program, raising household consumption by an amount A, and then another program, the savings program, raising consumption by an amount B. We can measure how much those programs are benefiting people separately, but then when we offer them together, we can also represent the benefit as A plus B plus C, where the number C represents complementarity between the two programs. And we say that the two programs are complementary if the impact of implementing these interventions jointly, implementing the subsidy and the savings program together, is greater than the sum of the impacts when you offer them separately. So basically, when you offer the subsidy and the savings program together, maybe you get A plus B plus C, where C is greater than 0. And this is basically the idea behind that the Millennium Villages project is motivated by. That basically, maybe if you implement a subsidy program by itself, it doesn't have that much impact. Maybe if you implement a savings program by itself, it doesn't have that much impact. But when you implement them together, you get a boost. Both programs are more effective, so you actually get C being greater than 0. The sum of the parts, the whole is greater than the sum of the parts. Is literally the idea behind the Millennium Villages project. So they're very much thinking about complementarity, positive complementarity between development programs. You might also imagine that the programs are not necessarily complementary to one another, but they might just be additive in the sense that when you do the two programs together, you get as much benefit as the sum of when you offer them separately. So in this case, C would be equal to 0, and implementing them together, gets exactly what you would expect from looking at what happens when you implement them separately. You just add up the two effects together. So if the subsidy program raises consumption by 3% and the other program raises consumption by 5%, when you implement them together, you get 3 plus 5, you get 8% increase in consumption, as an example. And finally, there's a possibility that the two are substitutes for one another, and this would be the case where C is less than 0, so where the joint impact is less than the sum of the parts, less than the sum of the separate impacts. So you might get, maybe you get an 8% increase from the subsidy program, 8% increase from the savings program when you implement them separately, and then when you implement them together, maybe you only get about 8 or 9% as well. So basically, it seems like you're not really getting programs, the programs aren't additive to one another, they seem to be substituting for one another. So this is another theoretical possibility that I want to highlight. Okay? So let me tell you about what we actually did in this study. We have several key collaborators. First of all, the provincial government of Manica, Banco Oportunidad, of course, was a key collaborator. And Banco Oportunidad was crucial for offering the savings program, which involved both financial education training as well as offering of savings accounts. The Food and Agriculture Organization and the European Commission provided funding for the subsidy vouchers. So these were, I'll talk about these in a moment. I should mention the provincial government of Manica was essentially providing their extension agents to actually interact with farmers and to actually implement the voucher program in the field. And finally, IFBC, International Fertilizer Development Corporation, which some of you may know of. They're based in Mozambique, they're based in Chimoio, and they provide their global expertise in design of fertilizer subsidy programs and in sort of extending education and extension about fertilizer to smallholder farmers. Okay, so we did the study in Manica. There were about 1,500 rural maize farmers across 94 localities in this study. We worked with the Manica Provincial Government's Extension Service, and we followed their usual practice of working with so-called progressive farmers, a subset of farmers within each village who stated that they were willing to use modern agricultural inputs. And there were a few other criteria as well that I won't get into, but basically we use exactly the same criteria that the Extension Service typically uses when identifying farmers for extension services. These lists were generated by government extension workers. These treatments were randomized, so this is very much using the cutting edge research design of a randomized controlled trial. And out of these 94 localities, we randomly assigned each locality to one of 3 savings treatment groups. They were either in a control group that didn't get any savings services, or a savings program, a basic savings group, and a matched savings group. And I'll say a bit more about those basic versus matched savings shortly. And then within each of these villages, within each of these localities, we also randomly assign people to getting a subsidy voucher for agricultural inputs. So that basically generates. So we have 3 different types of villages, and within each village we have subsidy winners and subsidy losers, and that generates 6 different groups for us to track. Okay, so let me tell you a little bit about these subsidy vouchers. So here's a voucher winner. He's very happy, as you can see. So that, like I said, within each village we have a number of study participants. We have about 30 study participants within each village, and 50% of the study participants were randomly selected to receive these vouchers. We just use a random number generator and sort of announce to villagers who had been selected to receive the voucher. What does this voucher do? It basically provides a 73% discount on a package of fertilizer for improved seeds that was designed by FDC for use in Mozambique. The package was worth about 3,160, well, exactly 3,160 meticais. These were redeemed by farmers at local input suppliers, agricultural input suppliers, many of which were actually developed by a different USAID program developing private agricultural input markets in the Beira corridor. So these were, these just to emphasize, these inputs, the inputs were not distributed, by us or by the the government, basically farmers would take these vouchers and get them in private input suppliers. The one thing I should mention is that this was not a full subsidy. This is a 73% subsidy, so farmers still had to come up with their own resources to complete about a quarter of the remaining value. And so we didn't get full redemption rates of these vouchers. Among lottery winners, 48% of people ended up using their vouchers to buy the input package. One thing you'll see here is that among lottery losers, there were 12% who used a voucher to get an input package, and this was strange because we didn't give them any vouchers, but it turned out that government extension agents, they were cooperative in many ways, but one way they weren't fully cooperative is that they actually gave some vouchers to the losers as well. So that's not what we would have wanted, but they did feel like for various reasons they wanted to do that. But what this means is that we certainly have a much higher percentage of people among the lottery winners using the vouchers than the lottery losers using the vouchers. And so it's really this difference, this 36 percentage point difference, that's going to be what's leading to differences between the voucher winners and the voucher losers. So clearly, as you'll see, the voucher winners are using more fertilizer than the voucher losers in general. Okay, that's about all I'll say about that. The other piece of the other key component aside from the subsidies, of course, is the savings program. So this is an image of BAM's Banco Móvil unit, which makes scheduled stops at a variety of locations around the Manica province to provide banking services. And so I just show this as a way of illustrating how the participants in the study were getting their banking services. So we informed that if they were in one of the savings program villages, we informed people about the locations of the BAM fixed branches, which were in Chimoio, as well as in Vila de Manica. And we also told them about where these Banco Móvil units were going to be and with what frequency, with what schedule they were going to be showing up near their villages. So this is just to give you a sense, if you know Manica province, where the different study villages were located. So the circles and the triangles are the different villages in which we conducted the study. There are 94 of them. The circles are the control villages, so these are the villages that where we didn't do the savings program. And then the triangles are the savings villages, and we're differentiating between the basic savings villages, which are the white triangles, and the black triangles, which are the match savings villages. Again, I'll say a bit more about what those programs are shortly. We're also showing here on this map the stars, which are banking locations. So fixed bank branches are the blue stars, and these are not just BAM but other bank locations as well, and they're concentrated in 4 different cities and towns: Chimoio, Manica, Catandica, and Susundenga. And then we're also showing red stars, which are BAM's Banco Móvil unit. So those are more widely dispersed. The whole point of that unit was to get banking services closer to people than the fixed bank branches that were in the villages, that were in the towns. So you can see the stars. The red stars are quite more widely dispersed than the blue stars, which are the fixed branches. So this just gives you a bit of a feeling for the physical geography of this program. Okay, what do we do in these savings treatments? So in each of these savings treatments, we started with a village-level information session on formal savings. So we very much started with a financial education and financial literacy effort, and where we emphasized that people could use savings for 2 general purposes. One is, for accumulating money for investment in fertilizer and other types of income generation opportunities, and also as self-insurance. So another, obviously, the other major function of savings is self-insurance. You create a buffer stock of formal savings, and you can draw on it if you get a negative shock or a bad time period of some sort, a health shock, for example, or a negative agricultural shock. That was the beginning of the intervention, and then over the next 2 months, we had one representative for every group of 5 participants. We basically grouped the participants in groups of 5, and they had one representative who received some follow-up training in town, and they were asked to convey what they learned from that training to their group mates back in the villages. So there was a little bit more of an extensive financial education via that mechanism as well. These 2 guys that you see here wearing the white shirts and the hats were basically the group representatives who were receiving the training in town. So they basically, we gave them a little bit of an identity as like people who were supposed to convey this training information back to their group mates by giving them these t-shirts and these hats, which have the BOEM logo as well as the IFPC logo on them. And as far as we can tell, people took their roles quite seriously. They were happy to have this designation and to just play this role within their villages, within their groups. As part of all of this training, even though we were sort of training people in general about how to save in the formal system and why they might want to save, we also encouraged them to open accounts, bank accounts at BOEM, either at the Banco Móvil or at the fixed branch locations. All right, so the savings, the financial education, you can imagine, might have just a very general effect on their savings as a whole, but of course, at the end, this was done in conjunction with BOEM, and so we were, asking them in particular to please go in and open bank accounts at BOEM in particular. Here's just a little bit, some examples of, the educational material that we provided people. It was nice for me to hear that, Sandra and company also provided a comic. We also provided a comic. We had this comic design that, it's basically just broadly about sort of how you can use savings at BOEM, and you can see the Banco Móvil unit there to increase investment in your farm and earn more, get more out of your farm in the future. Here's just some images of the savings game that people play. We also had part of the financial education involved having people play a very simple game involving savings in one period, which you can then invest and sort of earn higher income on your farm in the future. Okay, so that's broadly, these savings games of the financial education were common to both the basic savings and match savings treatment. Let me tell you a little bit about how those two were different, or what in particular match savings involved. So in the basic savings treatment, we offered just very standard savings accounts. There was nothing unusual or different, and there was no special incentive to use these savings accounts in terms of monetary incentives. And we raised account ownership at BOEM by about 16 percentage points. So in general, in our control villages, there was about 5% of villagers who had a BOEM bank account. And by 2013, and about 2 years later, that had risen to about 21% in the villages that got the basic savings treatment. So there was a big increase in account ownership at BOEM. The match savings treatment basically involved giving people effectively a very high interest rate over a short period. So we matched 50% of people's minimum balance during the match period. We capped the matching funds at 1,500 meticais. The match period was between August 1 and October 31, and we chose this match period very much with the agricultural cycle in mind. We basically started the match period a little bit after the harvest season, and it ends just before the next planting season. And so the basic idea is that if you save the full amount that you could possibly get a match for, which is 3,000 meticais, with the match, which amounts to 1,500 meticais, you could purchase the full input package for a 3/4 hectare plot. So we basically, in fact, we were very explicit to people that this is why we were creating this match program for them. That we wanted them to save during this time period between harvest and the next planting season, and we would basically help them reach about 4,500 meticais, which they could use to buy the input package themselves and then put it on their farms. Of course, even though this is how we proposed it to people were free to use the money however they wanted. So we didn't actually require that they use the money to buy fertilizer or agricultural inputs in general. They could just take it out and use it for whatever purpose, buy livestock, invest in other agricultural or anything. It didn't have to be a productive purpose either, because it was there was no restrictions on that. We offered this match for 2 years, 2011 and 2012. And this had a Slightly higher impact on account ownership at BOM, about 22 percentage points. So in the match savings villages, total account ownership at BOM was about 27% compared to this 5% in the control villages. So those are the treatments, and we also surveyed to find out what the impacts were of our program. Primarily, our primary source of data for that is surveys. So we surveyed people at the beginning, in April and May 2011, at the beginning of the project, and then we had 3 follow-up surveys in September of 2011, 2012, and 2013. So we followed people over 3 agricultural seasons. And whenever we these surveys were in September per site, we timed the surveys to be in September, well after the harvest season, so that we could look at people's agricultural output and their household consumption after the relevant harvest. So let me show you first of all what impacts we had on fertilizer use. So basically, what I'm showing here, the vertical bars here represent by how much fertilizer use increased compared to the control group. So the control group here is people in the no savings villages who didn't win the fertilizer voucher, didn't win the input voucher. So those people, people in this control group used fertilizer worth about 1,200 metric 1,200 metric in fertilizer in the control group. Compared to that group, people who won the voucher had 53.9% higher fertilizer use, and also similar increases in 3 out of the 4 other treatment groups. So basically, the first bar here, whether it's labeled voucher, is just the people who didn't get the savings program but only got the voucher, who won the voucher, and they had about 54% higher fertilizer use. The remaining 4 bars on the right, are the different types of treatments that you might have gotten if you were at the savings villages, either the basic savings villages or the match savings villages. And in those villages, you either didn't get a voucher or you did get the voucher. And across all of those villages, there was also big increases in fertilizer use, except for people who got just the basic savings treatment. So basically, if you got basic savings and the voucher, match savings and the voucher, or just the match savings program only, you had very large increases in fertilizer use as well, ranging from 46 to about 61% increases in fertilizer use. This is in kilograms or in metric, but not in the basic savings group. So it looks like what we take away from this is that each treatment in which we provided people a pretty strong incentive to use fertilizer was successful in raising people's fertilizer use. In the basic savings group, there was a small and statistically insignificant increase, 7.4%. I don't really consider that a meaningful increase. It's quite small and not statistically significant. So basically, in the basic savings treatment, we offered people incentives to save. As I'll show you in the next slide, they did save, but they didn't apparently use it on fertilizer, which is a bit disappointing, but not that surprising to us, frankly, because in that treatment there was actually no explicit emphasis on fertilizer. We can also look at impacts on formal savings. So how much do these treatments affect savings? It looks like all of the treatments actually did increase people's savings, and most dramatically as you might expect, the increases are largest in the savings villages. So if you got basic savings only, basic savings and the voucher, match savings only, or match savings and the voucher, then you had increases in savings ranging from 1,000 to 2,000 metric. These are just bank balances as of September of 2012 and 2013. This is just the average bank balances in 2012 and 2013. The biggest increases are for the people who got either the match savings program or the match savings or the basic savings and the voucher. If you got the voucher by itself, there's a modest increase, a smaller increase of about 700 metric in savings. So we definitely saw positive impacts on savings. The one big question that comes up is how much of these savings was at BOM versus at other banks. So that's what we're showing in this slide. So interestingly, so basically the red amounts are, the red parts of the bars are the increase in savings that occurred at other banks, not at BOM. The blue parts of the bars are the increases in savings that occurred at BOM. And so I think these results are quite interesting. Perhaps, basically saying that we provided a huge amount of financial education for people and a very strong incentive for them to save at BOM. They clearly did increase their savings at BOM in the savings villages, but there was a much bigger increase in savings at other institutions. So basically, the increase in savings at other institutions is actually much larger than the increase in savings at BOM. I think this is quite interesting, and there are a number of ways to interpret this. But I think one natural way to interpret this is that people's proximity to other banks probably was a big factor. We look at what's accounting for this increase in savings at other institutions, and the savings, the majority of those additional savings at other institutions is at Millennium BIM, and probably reflecting the fact that they have the largest bank presence in Manipur province, I imagine, and sort of elsewhere as well. So many people probably saw it. They were probably convinced by the financial education that they needed to be saving more, but they just chose to save more at BIM versus at BOM. Nonetheless, there was a big increase at BOM as well, which is not as big as the increase in other institutions. So we view this as perhaps a bit disappointing for BOM. They got a benefit, but not as big a benefit as all the savings that go to BOM. But actually, from the standpoint of development, the standpoint of reducing poverty, in some sense, it's not necessarily so important that they're saving at one particular institution, but it's more important that they're just saving somewhere. And so that's how we view this from a development standpoint. Okay. So I just showed you the impacts on fertilizer use over here at informal savings, but of course these are not ultimately measures of household well-being. These are in some sense intermediate steps towards improving household well-being. So we want to turn to looking at a very standard measure of how households are doing, which is daily consumption per capita. So as many of you probably know, one very standard way of measuring people's well-being around the world is to look at their consumption per day, per capita consumption per day. And so that's what we're doing here. What we're doing is we're looking at their average reported in the 2012 and 2013 surveys. So this variable is just the total value of consumption in the household divided by the number of household members, and we convert this to a daily frequency. Because we don't actually ask people how much you consume per day. We ask people for different items. We ask them how much they consume per week, per month, per year, depending on the item. We have very detailed questions about food items, so including food that they produce themselves on the farm. So this is not just food that's purchased, but it's also food that they produce and consume in the household. It also has expenditures on a variety of, almost every different thing you can imagine people spending money on. So that just wanted to give you a sense of how we're measuring people's well-being. So here's ultimately, that's ultimately how we're going to be measuring people's well-being, and here are those impacts. So the bars here are going to represent by how much does consumption increase compared to the control group. So again, the control group is people who are living in no savings villages and who didn't get assigned the fertilizer voucher. So compared to those people, compared to the control group, people who got the voucher by itself had higher consumption by 8 percentage points, 8.4%, 8.4% higher consumption. So that's quite a large and respectable increase in consumption. So in the control group, people's per capita daily consumption was about 72 megakaj. So the voucher caused that to increase by 8.4%. So that by itself is good news for people who are interested in subsidy programs. 2 or 3 years later, remember these vouchers were given out in late 2010. So in 2012 and 2013, consumption is higher by 8.4%. So that's quite good news for the subsidy program. Now, how much does consumption increase in the savings villages? So we're showing here, this next bar, the increase in consumption in the basic savings villages. So these are people who got just the savings program, but not the voucher. These are the voucher losers in the basic savings villages. Their consumption increases by about 9%. So very similar to the voucher program, and that's actually quite encouraging news as well. The savings program, even though it involved a great deal of interaction with people on staff time in terms of doing the trainings, it's much cheaper per recipient or per beneficiary than the voucher program. Remember, the voucher program is providing a large amount of resources to people. So in comparison, the basic savings program, much cheaper, but actually 2 or 3 years later, leads to about the same increase in consumption. That's quite good news for people who are interested in the development impacts of savings programs. How does the match savings program do? So that's the fourth space over here. The match savings program also does similarly, actually, about 9.9, close to 10% increase in consumption. So that's the match savings program, in contrast to the basic savings program, is much more expensive because we're providing people with these matches, and so it's leading to not a much higher increase in consumption. So in comparison to the basic savings program, I'd say it's probably not as cost effective. And then the question is, when it comes to complementarity, what happens when you deliver both the basic savings program and the voucher program together, or the match savings program and the voucher program together? What are the impacts there? And those are the impacts. So people who got the basic savings program and the voucher together, it looks like they only had about, we're estimating only a 3.7% increase in consumption. If you got the match savings program and the voucher, about an 8.8% increase in consumption compared to the control group. These results are surprising on a couple of dimensions. First of all, clearly there's no evidence that these programs are complementary or even additive. Offering both programs together doesn't even get you the same, according to these estimates, as if you implemented just one or the other program by themselves. Particularly surprising is this 3.7% for getting the basic savings and the voucher. That's very hard to explain. Why would consumption actually be lower if you got both programs together? One thing I'll basically say is that from a statistical standpoint, we can't actually say that these treatment effects are different from one another. We can actually, the standard errors around these estimates, the margin of error around these estimates is large enough that we can't actually say that the 3.7% for the basic savings and voucher is lower than these other treatments. So we just, we don't have quite enough sample size to say that. My suggestion would be not to be distracted by this middle bar that says 3.7%. It's kind of puzzling that it's lower than the other bars, but overall, our basic takeaway from this is that it looks like all of the treatments had about the same effect, more or less, on consumption, and there's definitely no evidence that the two programs are complementary to one another, or even additive to one another. They actually seem to be substitutes for one another, from the standpoint of raising consumption. You can raise consumption by about 8% if you offer people this voucher. You can also raise their consumption by about 9 or 10% if you offer them either of the savings programs, but offering them both together doesn't get you an additional impact. So it's actually quite strong evidence against the hypothesis of the Millennium Villages program, for example, that you really need the programs to work together in order to raise consumption. In fact, it seems that you don't get any additional benefit from offering them together than if you just simply offer them separately. And in particular, from this standpoint, it looks like the basic savings program by itself, from a cost-effectiveness standpoint, is really the one that you want to be scaling up because it's the cheapest and it gets about the same positive benefit in terms of raising people's consumption. Okay, so that's the broad pattern. These programs look more like they're substitutes rather than complements for one another, at least from the standpoint of raising consumption levels. If you take consumption, household consumption, as the ultimate outcome you want to influence, these programs really look like substitutes rather than complements. Why might this be the case? Here's what we think is going on. Basically, savings can play two roles. Savings can serve to increase investment, so basically you accumulate funds and use them productively in fertilizer or something else, but savings also plays a role in risk management. You hold buffer stocks and help you cope with shocks. This serves a self-insurance role, in other words. And it looks like, we think that households are probably using savings in a different way if they got the subsidy versus if they didn't. So basically, when you don't receive the subsidy, it looks like households are probably using the savings for investment. They're probably using both savings for both roles, both for investment as well as for risk management. But when you receive the subsidy, the recipients may be using savings just for risk management rather than for additional investment. So another way of thinking about this is that households may have a certain ceiling on how much they want to invest, at least initially, at least at the start. And so if you get households to a certain level of investment through the subsidy, then they're not willing to save more to invest even more than the subsidy allows them to. They basically will use the savings just for risk management rather than for additional investment. That's what we think is going on. There's a little bit of additional evidence that actually we think is consistent with this explanation, that sort of helps support this explanation. Let me show you, one piece of evidence for that. Basically, what I want to show you here is that it looks like the savings program is helping people manage risk. Let me just explain what's going on here. One measure of how much risk people are facing is basically this is a statistical measure, the variance of their consumption. So basically, if you look at how much consumption varies within certain treatment groups, that can give you a sense of how risky consumption is. I don't want to get too much into the details here, but one thing that's clear is basically that what I'm showing here is the impacts on consumption variance compared to the control group. And in the voucher group, there's a clear increase in consumption variance. It looks like consumption is definitely more risky. It varies more in the voucher group. It goes up about 0.09, and the actual number is not that important to interpret, but clearly the takeaway here is that people's consumption variance definitely goes up. They are facing more consumption risk when they get the voucher treatment compared to the control group. But one thing that's interesting is that in all of the savings treatment groups, there's not nearly as much increase in consumption variance. So basically, all of the other treatment groups are, basically they actually statistically don't have much higher consumption variance than the control group. So this is basically one quite striking pattern in the results. So this is fundamentally that's what I want to. I think this is the pattern in the result that is most revealing, that the savings programs are better helping people manage risk, to reduce the riskiness they're facing in their consumption. I have a few more. I think I'll skip some of the other statistical evidence and just jump to another pattern that we see as quite striking as well. It looks like people in the savings villages are also better at coping with negative agricultural shocks. So in every survey, we ask people whether the last agricultural season was a good year or a bad year. And it looks like in the subsidy-only treatment, people's household consumption is quite sensitive to having had a bad year in the previous year. So basically, people have, if you're in the subsidy-only treatment and you say that you had a bad year in the past year, that your consumption falls quite a lot. But in the savings treatments, this is not true. People in the survey will say, yeah, last year was a bad year from the standpoint of agriculture. But their consumption, when they say that, their consumption doesn't fall by nearly as much. In fact, it doesn't fall at all. So there's no relationship between having had a bad agricultural year and your household consumption for people in the savings villages. And that's quite striking, actually. And we think that's just another pattern that's suggesting that when people get these savings treatments, they're better able to cope with, they're better able to insure themselves, to basically keep their consumption from falling in bad years. So let me just wrap up, and I'm happy to take questions. So basically, what we're finding is that from the standpoint of raising consumption, subsidies and savings actually appear to be substitutes rather than complements. So every treatment on its own has a similar positive impact, but providing both treatments has no additional impact. And this is really quite contrary to the claim of various bundled development programs that there's going to be a positive complementarity between programs, at least between these two particular types of programs. Obviously, we're not testing the whole range of different development programs that you might implement in the context of something like Millennium Villages, but these are two very prominent types of interventions. And so this is the first evidence that these two very prominent types of interventions don't actually have a positive complementarity with one another. In fact, they're actually substitutes. It looks like people are using savings either for investment or risk management, sometimes both. Households who are receiving both subsidies and the savings treatments seem to focus on risk management, which is why the savings treatments don't seem to increase investment and consumption even further when you add the savings on top of the subsidies. Households that receive only the savings treatments may be using savings for both purposes. So at least that's what our results are suggesting. So I think broadly this really underlines how financial services can help households offset the increased risk that comes from getting a new economic opportunity like a subsidy. So there may not be complementarity between savings and subsidies from the standpoint of raising consumption, but households are getting a different type of benefit. They're getting, when they get both programs, they're actually better able to manage their risk. So there actually is a benefit from offering both programs together, but it's not in the area of consumption, it's in the area of risk management. And just said differently, the complementarities between development programs may actually show up in risk management rather than higher mean returns. So let me stop there, and thanks again for the opportunity to share these results. I'm happy to take questions.
What are we going to do now, just in the interest of savings?